Hi guys, welcome to episode 70 of the Tiny ADHD Superpower series. Today we're going to talk about drug-to-drug interaction and summarize the past 10 episodes specifically on the drug interaction with different medication and different illegal substances. So, for ADHD, medications and alcohol can lead to serious complications like alcohol poisoning and heart problem. Alcohol can also worsen ADHD symptoms and make stimulants less effective. No ADHD medication is safe to take with alcohol. Alcohol and ADHD medication may be even riskier for certain people, like older adults and women. So, can you take stimulants with Naltrexone? Naltrexone, which is sold under the brand name Revia, Revia, among others, is a medication primarily used to manage alcohol use or opioid use disorder by reducing cravings and feelings of euphoria associated with the substance use disorder. I think it's similar like methadone. I never had it, so I don't know. Naltrexone may reduce stimulant-related euphoria. Positive finding from a preliminary clinical trial of a young adult with ADHD suggests a methylphenidate naltrexone combination could actually benefit people at risk of stimulant addiction without any loss of clinical efficacy. So, what drug can you not take with methylphenidate? This should become common knowledge to you. Avoid taking MAO inhibitors, MAO inhibitors, during treatment with this medication. Most MAO inhibitors should also not be taken for 2 weeks before treatment with the ADHD medication. People with multiple diagnoses tend to be more in the danger zone when taking compounded medication, such as people that have schizophrenia. ADHD doesn't have the same dangerous effect when taking the medication than other mental health diagnoses. So let's move on to Vyvanse versus Adderall. I just found something funny. I know I mentioned it in my previous episodes before about Vyvanse and Adderall in detail, but here it says study comparing the drugs are limited. One analysis of 20 studies found that in adults, ADHD symptoms improved significantly with either Vyvanse or mixed amphetamine salts, which is Adderall, but the effects were somewhat stronger with Vyvanse. Some research suggests otherwise, so it really depends if your body it's better to take pro drug to the extended release or immediate release. So, what is the strongest ADHD medication was debatable. On Google, it says Adderall. Personally, I did not find any benefit in Adderall, even though it's pure amphetamine salts. I fell asleep taking one entire week's worth of prescription in one day, and I fell asleep because it just wasn't working for some reason. I don't know, maybe I should try it again, but I'm not switching for methylphenidate. I've been on it for 25 years. It's the most stable medication I have, and I am sticking to it. So, there's something also called the Ring of Fire ADHD. It's a type of ADHD characterized by abnormally increased activity in multiple areas of the brain, which an individual on QEEG brain mapping scan can appear as overactivity or overstimulation. Oh, by the way, yeah, I'm going to ask my psychiatrist to get a PET scan, and, any scan as possible for my brain. And I want to know. If Dr. Amen, you're listening to this, please shed some lights on that for me, please. Next, megadosing caffeine. Megadosing cigarette. Caffeine is the most popular brain-altering chemical that improves alertness, attention, and focus, at least briefly for a very short amount of time. For many people, caffeine may be improve memory, learning, complex problem-solving, mental stamina, and more. If you're sleep deprived, mentally fatigued, or experience a midday dip in energy, caffeine may provide a temporary boost and relief. However, there's no research supporting evidence that caffeine is a valid treatment for ADHD. Well, then everybody would have ADHD because everybody drinks coffee. That sounds funny. While it provides general cognitive benefits, caffeine doesn't activate the parts of the brain that improve executive functioning. It's prescription stimulants too. So ADHD medication, what not to eat, food and drinks. These are just a very interesting one. They're not like, bullshit ketos and stuff like that. No. Drinks rich in ascorbic acid, vitamin C, or citric acid may interfere with the absorption of Ritalin or methylphenidate. Citric acid breaks down the medication before it has a chance to be absorbed by the body. So avoid taking acidic drinks when you're taking your methylphenidate or ADHD medication. Fruit juices, vitamin C, some drugs can also affect amphetamine, which is Adderall, alkali agents such as antacid increase amphetamine absorption. Amphetamine should not be used along with tricyclic antidepressants or decongestants. So watch out for that. Almost done. This is 70. I'm doing a good job. How to deal with high-functioning ADHD people like us. The path to managing high-functioning adult ADHD is diverse as symptoms themselves, requiring a nuanced approach to treatment and support. Effective management strategy often combine medication, therapy, and lifestyle adjustments. I mentioned about CBT as well as dialectical behavioral therapy, which is DBT. Use your superpowers and super willpower to improve your life. It's one of the most important self-reflection anyone can have. Do this every day, every second of the day, and you will find something amazing in yourself. So lastly, let's move on to dementia, and then we'll all die. The prospective cohort study examined association between adult ADHD and dementia risk. The present study results show that adult ADHD diagnosis was associated with a 2.77-fold increased risk of incident dementia. Complementary analysis generally support this association. Now, I find that a little bit weird because I'm not a doctor, but I am from a pharmacist family. I do have my, pharmacy tech license that I can work at the pharmacy. I decided on to go into pharmacology because I wanted to do business on the healthcare side. So, in my opinion, dementia are disconnect of neurons, and they're the dying neurons that cannot transport the signals from one neuron to another or a neuroreceptor to another. But since methylphenidate increases the connection, wouldn't it benefit dementia? Can somebody shed some lights on that for me, please? And just give me a tag. I've been thinking about this for a long time, and I read a lot about dementia because my grandma has it. But stimulants working with dementia might just work. So somebody please let me know, okay? I'm not an expert. I'm not a MD. I am not even a nurse. I am just knowledgeable in the healthcare industry and medications. That's all. Thank you. Take care.